With enteroscopy, we use a long, flexible tube that we insert into the mouth, and it passes into the small bowel. Because the small bowel is so long, push enteroscopy, which is what I just described, was very limited in its ability to go deep into the small bowel. And so in 2001, in Japan, a new technique was developed called double balloon enteroscopy. And with this technique, it uses a balloon and an overtube to be able to advance more deeply into the small bowel and to see areas of the small bowel that were previously inaccessible to us. And this allows us to use non-surgical techniques and treatments for large polyps and masses, and to do biopsies of lesions very deep in the small bowel. With double balloon enteroscopy, it uses an Enteroscope that has a flexible tube, a flexible overtube with it. And it has a balloon at the end of the overtube, and it has a balloon at the end of the Enteroscope. And by using both of the overtube and the balloon, we're able to achieve very deep insertion into the small bowel. And the name double balloon enteroscopy actually comes from the two balloons that are used, and that is one balloon at the tip of the overtube and one balloon at the tip of the Enteroscope. The double balloon enteroscopy is performed by alternately inflating the balloons at the end of the overtube and the balloon at the end of the Enteroscope. By doing that, and by pushing and pulling the instrument, we're able to pleat the small bowel onto the overtube. And this shortens the length of the small bowel and allows us to go deeper into the small bowel. And if you think about sewing, where you have fabric that perhaps you're trying to gather onto elastic, or if you have a curtain rod and you're trying to gather the curtain onto a rod. That is what we're doing with the small bowel. But ultimately, by repeating these steps multiple times, we're able to advance the Enteroscope and the overtube deep into the small bowel. Double balloon enteroscopy can be performed via the upper GI tract through the mouth, which is called antegrade, or it can be performed via the lower GI tract through the colon, which is called retrograde. In some patients, the entire length of the small bowel can be evaluated by combining both the antegrade and the retrograde procedures. The procedure can be performed as an inpatient or in patients who are outpatients. The anesthesia used is usually general anesthesia, but frequently moderate sedation can also be used, depending on the clinical scenario. Sometimes the procedure is performed with fluoroscopy or x-rays to help identify the location of lesions. Double balloon enteroscopy can help patients who have lesions very deep in the small bowel. For instance, patients who have had video capsule endoscopy, which has found bleeding lesions very deep in the small bowel. Patients who have had other modalities, such as CT scans, and a polyp or a mass or a worrisome lesion has been found. Or a patient who has had a stricture found on another modality. Or even a patient who has a foreign body or a retained video capsule. Double balloon enteroscopy can address all of those issues. In addition, for patients who have had surgically altered anatomy, such as a gastric bypass, double balloon enteroscopy allows us to access the biliary system to perform, to remove common bile duct stones or to place biliary stents as is needed. So some patients may need colonoscopy and upper endoscopy before the double balloon enteroscopy, but this is not always necessary and depends on the clinical situation. With With double balloon enteroscopy, we're able to treat bleeding lesions, we're able to dilate strictures, we're able to biopsy masses, we're able to remove polyps, we're able to remove foreign bodies, we're able to remove common bile duct stones, and to place biliary stents. This technology allows us to offer patients a non-surgical treatment for many lesions that are found deep in the small bowel.